Hi, I'm Dr. Michael Helms of Indy Podiatry in Central Indiana. One of the most common surgical procedures that the doctors at Indy Podiatry do involves correction of a bunion deformity. I want to spend a few minutes talking about what you can expect if you have that surgery over the course of the first week and what you need to do. When the surgery is done, you'll get a large, thick dressing on your left foot, and you're to leave that dressing on and dry until you have your first post-operative visit the following week. Don't be surprised if you see a little bleeding on the bandage. That's normal, and it is not a cause for concern. During that first week, you are to keep off of the foot entirely. In other words, no weight on the foot that had surgery. We encourage our patients to get a knee roller, which allows you to move around from room to room without putting any weight on the foot at all. Most of the time during that first week, you're going to be off your foot and keeping it elevated. If you're on a couch or a bed, you just put a pillow or two underneath your foot, and that's enough elevation. You can sit anywhere you want though, but just make sure you're elevating your foot as high as your hip or just a little bit higher. Think in terms of gravity. Any of the blood and fluids that are returning from the surgical foot, we want them to be running slightly downhill with an assist from gravity. That way you'll have much less swelling and you'll feel a lot more comfortable. Towards the end of the procedure, just before you have the bandage put on, and you'll still be sleeping at this time, a long-acting local anesthetic will be injected into the surgical area. For some people, long-acting is 2 or 3 hours, but sometimes the local anesthetic following these procedures will last 18, 20 hours or more. So if the evening of the surgery your toe is numb, it's not a cause for concern, it's not a reason to call us, it's actually a good thing. Often that anesthesia will last into the next morning before your toes and your foot completely wake up. It's important that you ice a lot following this surgery. If you have surgery at Nab Road Surgery Center, where most of our surgeries are done, the nurses will send you home with 2 reusable ice packs. The ice packs Velcro around your foot, so you can have one on your foot and one in the freezer. You don't have to time how long that ice is on. The bandage is thick enough, you can just leave it on until the ice is no longer cold, and then a little later swap the ice out. The one that was in the freezer goes on your foot and refreeze the one you had been using. You don't have to ice continuously, but lots and lots of icing the first week will keep you much more comfortable, and it will also keep swelling down. So lots of icing during that first week post-operatively. It's hard to say how much pain you will experience after this surgery. Most people have much less pain in the first week than they anticipate. Many of our patients don't take any pain medication and don't need any prescription pain medication. You will likely get a prescription for some pain medication, but our advice to you is to use as little of it as possible. After that local anesthetic wears off, if you do need to take some of that pain medication in the first 2 or 3 days, that's what it's there for. However, studies show and experience shows that most people can get the same amount of pain relief by using a combination of ibuprofen and acetaminophen or Tylenol. I recommend that people get just 325 milligrams of acetaminophen rather than the extra strength, and then you can alternate the two. Take 2 ibuprofen, and 2 hours later take 2 325 milligram acetaminophen, and 2 hours later the ibuprofen again. And for most people, this amount of medication is enough to control the pain that you might have in those first few days. Again, many of our patients don't need any narcotic pain medication if they follow this routine. This information, although I mentioned bunion surgery, is also good for many of the other metatarsal and forefoot surgeries that we do. If you're having surgery with me or having surgery with one of the other doctors, we will likely direct you to this video so that you can get the right information for that first post-operative week.